Professor Aalim. He's a professor in Mumbai University. His academic experience, Academy of Advanced Homeopathy, and he arranged many courses in homeopathy. He is practicing homeopathy now in Dubai, and he is running advanced homeopathy clinic. Professor Aalim, the microphone is you, and thank you so much for joining us and giving this lecture. Thank you so much.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much, Professor Yusuf. It is my great honor, and I thank you for your kind opportunity for me to be present here in this August gathering with reputed speakers and respected attendees who are interested in learning and understanding the role of complementary and alternative medicine, as well as other modalities in medical field, which can help people in Gaza and all over the world who need help. Bismillahirrahmanirrahim. I will be presenting my topic today, which is to focus more on how homeopathy deals with mental health, whether it is in conditions of trauma because of the war situation in Gaza, or in any other situation where person is affected mentally or his mental health is disturbed, how homeopathy as a traditional and complementary medicine supports it. Before we talk about how homeopathy helps it, it is important to understand what are the different types of common mental health problems. Okay, to introduce myself, I am Dr. Aalim Dhandukia. I am basically from India, Mumbai, and I've been into homeopathic practice and teaching homeopathy to college students as well as to laymen who are interested in knowing about homeopathy. So I run a lot of online courses of short duration and of long durations online to teach them how to practice homeopathy or to understand what homeopathy is all about. So it kind of creates an awareness in the general people about basic concepts of homeopathy, and they are able to understand what exactly homeopathy is beneficial for. And I'm also a practitioner of homeopathy, and I practice in Dubai as well as Mumbai. Plus, we also cater to health needs of people around the world, and we are attending to patients in more than 20 countries through our online platform. Going forward, about the topic today that I want to share, I have learned a lot today from Professor Ahmed about the integrative approach and how traditional and complementary medicine needs to be regularized and practiced in a more scientific way with an evidence-based approaches. Mental health, if we are able to see in this, okay, the current war between Gaza and Israel is undoubtedly having a significant psychological impact on people living in Gaza. It is important to recognize that this subject is complex and multifaceted, and individuals may experience a range of psychological effects based on their specific circumstances and past experiences. However, the common psychological impact that individuals in Gaza may experience include post-traumatic stress disorder, what we commonly understand it as PTSD, the constant threat of violence, bombing, loss of lives during war can lead to long-lasting psychological trauma. Why we are talking about this is that if we as a homeopath want to help somebody in a situation like this, it is our responsibility that we first understand the cause of the problem that person is suffering from, so that we can help him accordingly. Those directly exposed to the violence, such as survivors of attack or individuals who have lost loved ones, are particularly vulnerable to developing PTSD. The mental health condition is characterized by intrusive memories, nightmares, flashbacks, and extreme emotional distress related to traumatic events. This is just one group of symptoms or one category of condition that you may come across in handling people in mental health. Another problem is anxiety and fear. Living under constant threat can instill a pervasive sense of fear and anxiety in individuals. The uncertainty and unpredictability of war can make it challenging for people to feel safe and secure, resulting in heightened anxiety levels. The stress and uncertainty of living in a war affected environment can contribute to the development of anxiety disorders. Depression and grief. Witnessing the destruction of homes, infrastructures, and loss of lives can lead to feeling of sadness, hopelessness, and grief. The ongoing nature of conflict can make it challenging for individuals to process their emotional and find sense in normalcy. We in our homes, if we lose out on something, if our car breakdowns today, or if our son doesn't do well in exams, we panic. If our salaries are delayed, we panic. If our promotions are delayed, we panic. So imagine in our normal life when such small things can cause us anxiety, what would be the impact of the people going through these traumas for years and years. Displacement and loss of resources. Many individuals in Gaza have been displaced from their homes due to the conflict, resulting in loss of security, stability, and access to basic resources. This displacement can contribute to feeling of frustration, helplessness, and sense of being uprooted from one's community. People forced to flee their homes due to war often experiences feelings of displacement and loss of identity, drastic changes in living conditions. You are living in your own house and suddenly you are on the roads, or you are in a shelter, or you are in a camp, the refugee camps. The life is very challenging and things are very different out there. Psychological impact on children. Children in Gaza are particularly vulnerable to the psychological effects of war. They may experience intense fear, exhibit behavioral changes, or have difficulty sleeping and concentrating. These experiences can have long-term consequences on their well-being and development. Traumatic loss, loss of family members, friends, community members during war can result into complicated grief reactions and increased vulnerability to mental health disorders. Trauma related to physical health issues. Individuals impacted by war may experience physical health problems due to trauma they endured, such as headache, chronic pain, and ulcers. Children and adolescents. War affects children and adolescents differently. They may experience a developmental delays, poor academic performances, increased aggression, and behavioral problems. We are seeing that a lot of aggressive behaviors are being thrown in different countries. Somewhere these people have been suffering from such traumas in their own country, which results into their aggressive behaviors in the other countries. They are also vulnerable to long-term psychological consequences that can impact their future well-being. Substance abuse is another very significant side effect of these situations people are subjected to. The stress and emotional burden experienced by individuals affected by war may increase the risk of substance abuse as a coping mechanism. Interpersonal relationship is a new challenge. The breakdown of social structures, disruption of support system, and exposure to violence can strain relationship, leading to difficulties in forming and maintaining healthy connections with others. It is crucial to note that these psychological impacts can vary from person to person, and not everyone will experience them to the same degree. So assessment of the degree of impact from person to person is essential, and you cannot have a generalized approach, or you cannot have a standardized approach to manage these mental health problems with homeopathy. It has to be very personalized, and you have to know what is the impact that person is going through. And homeopathy itself is not a generalized science, it is a very individualized science. So two people suffering from PTSD may receive different remedies depending upon the kind of characteristics and kind of impact they are exhibiting. Additionally, access to mental health resources and support can be limited to conflict zones like Gaza, and which further exacerbates the challenges faced by the individual. We want to help, we all as a medical community want to help, but our ability to deliver the care is a challenge. And in that challenge, who suffers the most is the person who is going through the problem. They are not receiving the kind of help which further deteriorates their condition, is the point that I'm trying to make. Treatment of PTSD, we all know that counseling sessions are one of the significant treatment modality which cannot be substituted. And even if person is taking help from homeopathy or hijama or herbal medicine or anything else, we cannot overrule the role of counseling. And certain behavioral therapies, evidence-based therapies for PTSD includes CBT, that is cognitive behavioral therapy, eye movement desensitization and reprocessing. CBT helps individuals identify and change unhealthy thoughts and behaviors related to trauma. EMDR can help process traumatic memories using eye movements or other types of bilateral stimulations. There are certain remedies in homeopathy which are proved and have been time tested and clinically verified in thousands of patients who have come across PTSD. And I have personally helped many patients in my practice with remedies. I am putting forth just few remedies which I have frequently used, but the list is not limited to these remedies. There is a remedy Ignacia amara, which is a plant-based remedy, Natrum muriaticum, which is a mineral-based remedy prepared from the kitchen salt, and Staphylococcus aureus is again a plant-based remedy. These remedies are helpful in people having suppressed anger and suppressed emotions for a long time, resulting from traumas. Treatment of fear and anxiety. Treating fear and anxiety can be vary depending on the individual and the severity of the symptoms. Deep breathing exercises, progressive muscle relaxation, again CBT are the practices that ameliorates or gives relief in day-to-day discomfort experienced as a result of anxiety and fear. Anxiety and fear as a clinical condition is very different than somebody having a fear of or certain phobias, like somebody suffering from fear of height or somebody suffering from fear of water and avoid going to swimming pool. These are all phobias which are not clinical anxiety disorders. But when somebody is suffering from clinical anxiety disorders, which we very often see in our clinical practice, especially the panic disorders. The other day, a patient was traveling to her home country. The patient is already suffering from panic disorder, and I've been managing that patient for a long time. But before 10 days of her travel, she kept on messaging me that, doctor, please give me something. I have to take a flight and I'm very scared. And these are the daily problems that a person from suffering from panic disorder may experience. And as a therapist or as a homeopathic practitioner, we have to be prepared to help them not only by giving the remedy, but also guiding them well in maintaining and overcoming their fears and anxiety. Again, homeopathic remedies, few of them which I would like to mention here are Arsenicum album, Argentum nitricum, Aconitum, Hyoscyamus. These are all very, very good remedies which we have used regularly in our practice to overcome the anxiety disorders. Now, Arsenicum album will have a different presentation than Argentum nitricum, and Aconitum nepalus and Hyoscyamus will have a different presentation than the other two remedies, although all are suffering from panic disorders. That is the key feature in homeopathy, which I want to convey, that homeopathy is not generalized. So even if you are taking a homeopathic treatment from somebody, and if somebody prescribes you bulk of medications, like take 3 remedies together, 4 remedies together, then it is not the right approach and you will not be relieved or cured on a sustained way. homeopathic practice is always a concept of single remedy, and that single remedy is enough for one person to overcome their mental health problems, and they don't need combination of remedies. Treatment of suppressed anger. Treating suppressed anger requires a combination of self-reflection, self-awareness, and healthy coping mechanisms. There are some steps that may help. Acknowledging and identifying your anger, that you should acknowledge first that you are unnecessarily getting angry, or you are getting angry out of proportion. Okay, which is very much important. Self-awareness is very much important. Find healthy outlets, engaging in activities that helps release and healthily channel your anger. Instead of bursting out and instead of showing an aggressive behavior, whenever you are angry, try to channelize your anger, or we need to teach patient how to channelize their anger. Practicing relaxation techniques, express your feeling assertively. If I recently come across a family where two brothers are fighting a lot, elder brother and younger brother, they are fighting. Grown up adult kids are fighting over small matters, and sometimes the fight even gets violent. All that I had to intervene and guide the patient is that what you are trying to express is through violence and anger. Same thing you can express in a matured way, in an amicable way, and in a firm way, that this is what is not acceptable and this is what I don't want. Same thing you may choose to express through anger, and same thing can be expressed in a nicer way. Remedies like Aurum muriaticum, Natrum muriaticum, Silesia, Staphysagra again are remedies which are very helpful in people who cannot control their anger and who have a very aggressive way of expression of their basic emotions and basic feelings. Treatment of chronic hatred. Suppressed anger leads to chronic hatred, and treating chronic hatred can be a challenging process, but it is possible with the right approach. Here are some suggestions. Again, self-reflection, taking a therapy, and practicing empathy are the basic ways in which we can guide people to reduce their hatred. Now, why we are bringing on these specific mental health issues is, again, there is a reason for it, that these are the challenges which person will come up with as a mental health problem in a war affected region where they have lost everything and they have developed so much hatred about everyone. Now we are seeing that in the world there is somewhere football World Cup is happening, there is somewhere uh, cricket World Cup is happening, and there are some celebrations are happening, and because of the social media and internet, all these informations are also available to people in uh, countries where they are affected with war. And when those young minds, those children, when they see such celebrations happening around the world, and when they see what's happening to them, it is definitely going to create hatred. There is no love that is going to be created. So we need to be aware when we are trying to address the problems of people suffering from such war. Cultivating gratitude is another way of reducing hatred. Engaging in self-care, challenge negative beliefs, are all these ways in, but this is not something person can do on their own. They need some counselors, they need therapists. And the good part is that homeopathy and the counseling are not limited to geographical restrictions, and the care can be delivered to people from a long distance. Like many other medical modalities, will need a physical presence of the therapist and the patient at one certain center or certain place. Like somebody asked that the hijama can be given to people over there. Why do we need to give hijama? But even for hijama, you need to be physically present there. But the biggest plus point and advantage of homeopathy is that the therapist or the doctor does not need to be personally present, and the care can be given through long distance online management. There are so many other things that I we have already spoken about. Treating aggressive and destructive behaviors depends on underlying causes and the individuals involved. Here are some of the general strategies and considerations. Seek professional help. I already spoke about it. Identify trigger and patterns. I already spoke about it. Practice anger management techniques. There are so many anger management techniques which a therapist can easily guide. Improve communication skills, build empathy and emotions, establish clear boundaries and consequences. The example I just gave of two brothers, as a therapist, I told them that you need to be establishing clear boundaries rather than intruding on each other's zones. Encourage stress management, healthy coping mechanisms, and consider medications. Now, peculiar healing qualities of homeopathic remedies in mental health is I want to highlight some of the remedies. Now I already spoke about the remedy Ignatia. It is a commonly used for symptoms of grief, disappointment and suppressed emotions. This remedy is often useful for individuals who experience grief, sadness or shock, especially after a loss of, or betrayal. Now you can understand the betrayal and loss can be the common emotions in people affected with war who have lost everything. It may help with emotional sensitivity, mood swings, and suppressed emotions. But the peculiarity of Ignatia patients or those patients who will need Ignatia are that they are very responsible people and they love to take responsibility of their loved ones, of their family. And although they are responsible and mature people, they experience mental health disturbance. Another remedy is Staphysagrea, which is again a plant-based remedy. This remedy is often suggested for individuals who hold in anger, resentment, and deep-seated emotions. This remedy is often recommended for individuals who have experienced emotional trauma related to feeling of humiliation, indignation, and suppressed anger. It may help with addressing feelings of victimization and may promote emotional healing. Now you can understand whatever emotions we are discussing under the remedy's ability to heal Staphysagrea. You can identify these emotions the person, many of them may be going through in war zones or those who are the victims of war. Okay, so now, but the quality or peculiarity of Staphysagrea is that they won't easily express. They will not show their hurt, they will not show their suppressed anger that easily, and that will go on for years. They will not show, and then they will have a final outburst. They will suppress and hold back for years together, and then they will burst like a volcano. Lycopodium is another plant-based remedy. It is given when there is a tendency towards irritability, suppressed emotion, general sense of dissatisfaction. But the quality of Lycopodium is that they are always boastful and they are always trying to dominate others. So you can see the difference between Ignatia and Staphysagrea. Lycopodium, you will be easily identified by somebody whom you talk for 10 minutes and he starts boasting about himself, you think that this could be a patient of belonging to Lycopodium. Another strong remedy is Natrum muriaticum. This remedy might be considered for individuals who have experienced emotional trauma or have difficulty expressing emotions. This remedy is typically suggested for those who have experienced long-term grief, humiliation, and disappointment. It may assist in addressing emotions such as bitterness, guilt, and resentment. Staphysagrea and Natrum muriaticum are almost similar to each other with minor differences at other levels, but mentally both are same, and sometimes it is difficult for us as a therapist to differentiate whether the person needs Staphysagrea or Natrum muriaticum. Aurum metallicum, is a remedy prepared from gold. It is sometimes recommended for those experiencing deep-seated anger, hatred, or extreme emotional distress. This remedy may be indicated for individuals who experience severe depression, feeling of worthlessness, and loss of self-esteem. The most important and key aspect of somebody who needs aurum metallicum as a remedy, or the key aspect of that person is that it's very high sense of guilt. They blame themselves a lot for everything that happens around them. And this blame is coming from their high self-worth. They feel that they can be the world leader, they can change the world. And if they cannot change the world, it is they who have done wrong, and it is they who have not fulfilled their responsibilities. Many reputed leaders around the world represent aurum metallicum as a personality. It is commonly used for those who have experienced significant emotional traumas and may assist in restoring emotional balance. Arsenicum album. This remedy is typically suggested for individuals who experience anxiety, restlessness, fear due to emotional traumas. It may help with feeling of insecurity, restlessness, and obsessive thoughts. The most insecure remedy is Arsenicum album. It is said that Arsenicum album patient spends entire their life in gathering wealth, and it is never enough for them because they want to secure their and their family's future. So these are some of the ways in which we as a homeopaths differentiate patients suffering from different mental health problems and identify how we can help them. And we not only give homeopathic remedies, but since we go into analysis of the deeper emotions, we also act as a counselors and help them. And we are trained in counseling patients suffering from mental health problems as a part of our curriculum and a part of our graduation and post-graduation training. And it is an integrated part of homeopathic treatment that counseling and guiding patients over handling their mental health is by default a therapeutic modality of homeopathic approaches. Thank you so much. This is a short talk with the limited time that was available, and I don't wish to take more time of the respected gathering.
Thank you so much for this very quick but very informative. Actually, it opens the way for people to try to know more and more about homeopathy, and perhaps some people will be stimulated to practice homeopathy as well. Thank you so much.